Your doctor hands you a prescription. You nod, take it home, and that weekend you have a drink. Just one. What could possibly go wrong? Everything. And I mean everything. Most people think mixing alcohol with medication is just about getting a little dizzy or sleepy. But the reality is far more dangerous than that. Some combinations can literally shut down your organs. Others can make your medication completely useless. And in some cases, you could end up in the emergency room without even knowing why. Here's what makes this even scarier. Millions of people do this every single day without realizing the risk. They take their morning pills with coffee, go about their day, and have wine with dinner. They think they're being responsible because they're not getting drunk. But alcohol doesn't need to make you drunk to cause serious problems with your medications. Let me break down exactly what happens inside your body when these two substances meet. And trust me, once you understand this, you'll never look at that glass of wine the same way again. First, let's talk about your liver. This organ is basically your body's detox center. It processes everything you consume, including both alcohol and medications. When you introduce both at the same time, your liver gets overwhelmed. Think of it like a factory that can only handle one product at a time. When you force it to process two things simultaneously, it can't do either job properly. This creates two major problems. Either your medication doesn't get broken down correctly, which means it builds up to dangerous levels in your bloodstream, or your liver prioritizes processing the alcohol first, which means your medication doesn't work at all. Neither scenario is good. Both can be deadly. Now let's get specific about what medications are most dangerous to mix with alcohol. Painkillers are at the top of this list. If you're taking anything with acetaminophen, which includes common drugs like Tylenol, mixing it with alcohol can cause severe liver damage. We're talking about permanent, irreversible damage that could require a liver transplant. The scary part? You won't feel it happening. Liver damage doesn't hurt until it's already severe. You might feel fine for weeks or months while your liver slowly fails. By the time symptoms appear, the damage is already done. People have needed emergency liver transplants from just a few instances of mixing these substances. What about antidepressants? This is where things get really complicated. Alcohol is a depressant. Antidepressants are designed to balance your brain chemistry. When you add alcohol to the mix, you're essentially working against your medication. The alcohol can completely cancel out the effects of your antidepressant, making your symptoms worse. But it doesn't stop there. Some antidepressants, particularly MAOIs, can cause dangerous spikes in blood pressure when combined with alcohol. We're talking about blood pressure high enough to cause a stroke. And certain types of antidepressants mixed with alcohol can lead to extreme drowsiness, impaired judgment, and even blackouts. Sleeping pills and alcohol create an especially dangerous combination. Both substances depress your central nervous system. When you combine them, you're essentially hitting the brake and the gas pedal at the same time. Your breathing can slow down to dangerous levels. Your heart rate can drop. Some people have stopped breathing entirely in their sleep. This isn't just theory. Emergency rooms see cases like this all the time. Someone takes their prescribed sleeping pill, has a nightcap, and never wakes up. Their family finds them the next morning. It's tragic and completely preventable. Blood thinners present another serious risk. Medications like warfarin are designed to prevent blood clots. Alcohol also thins your blood. When you combine them, you create a bleeding risk that can be catastrophic. A minor fall could cause internal bleeding. A small cut might not stop bleeding. Some people have had brain hemorrhages from this combination. Diabetes medications are another critical concern. Alcohol affects your blood sugar levels dramatically. It can cause them to drop dangerously low, especially if you're taking insulin or other diabetes drugs. This condition, called hypoglycemia, can lead to confusion, seizures, loss of consciousness, and even death if not treated immediately. The tricky part about diabetes and alcohol is that the symptoms of low blood sugar can look exactly like being drunk. Confusion, slurred speech, loss of coordination. So if someone sees you having a medical emergency, they might just think you're intoxicated and not get you the help you need. Antibiotics are commonly prescribed, and many people don't think twice about having a drink while taking them. But certain antibiotics, like metronidazole and tinidazole, can cause severe reactions when mixed with alcohol. We're talking about violent nausea, vomiting, rapid heart rate, and dramatic drops in blood pressure. Even antibiotics that don't cause immediate reactions can be problematic. Alcohol can reduce the effectiveness of the medication, which means your infection might not clear up properly. This can lead to antibiotic resistance, making future infections harder to treat. Heart medications require special attention. If you're taking drugs for high blood pressure, mixing them with alcohol can cause your blood pressure to drop too low. This can lead to dizziness, fainting, and falls that result in serious injuries. For older adults especially, a fall can be life-threatening. Some heart medications also affect your heart rhythm. Alcohol does the same thing. Together, they can cause irregular heartbeats that might trigger a heart attack or stroke. The risk increases significantly with each drink you have. Now let's address a common misconception. Many people think that spacing out their medication and alcohol consumption makes it safe. They take their pill in the morning and drink at night, assuming enough time has passed. But that's not how it works. Most medications stay in your system for much longer than you think. Some remain active for 24 hours or more. The half-life of a drug, which is how long it takes for half of it to leave your body, can be several hours to several days depending on the medication. This means TREs overlap no matter when you drink. Another dangerous myth is that the type of alcohol matters. People think beer is safer than liquor, or wine is more acceptable. But your liver doesn't care whether you're drinking beer, wine, or vodka. Alcohol is alcohol. The amount matters more than the type, but even small amounts can cause problems with certain medications. Some people also believe that if they don't feel any immediate effects, they're in the clear. This is perhaps the most dangerous misconception of all. Many medication and alcohol interactions don't cause immediate symptoms. The damage happens silently, building up over time until suddenly it becomes a crisis. So what should you do? First, read every medication label carefully. Most prescription bottles have warnings about alcohol, but people often ignore them. Take these warnings seriously. They're not suggestions. They're based on real medical evidence of harm. Second, talk to your pharmacist. Not just your doctor, but your pharmacist too. Pharmacists are medication experts and they can give you specific information about your prescriptions and alcohol interactions. Don't be embarrassed to ask. They've heard it all before and they want to keep you safe. Third, be honest with your healthcare providers about your drinking habits. They're not there to judge you. They need accurate information to prescribe medications safely. If you regularly drink alcohol, certain medications might not be appropriate for you, and your doctor needs to know that. If you're taking multiple medications, the risks multiply. Each drug can interact with alcohol differently, and the drugs can also interact with each other. This creates a complex situation where predicting outcomes becomes nearly impossible. The safest approach when taking any medication is to avoid alcohol completely. For those who struggle with alcohol dependence, this becomes even more critical. Suddenly stopping alcohol while taking certain medications can also be dangerous. If you're dependent on alcohol and need to start a new medication, you need medical supervision. Don't try to handle this on your own. What about over-the-counter medications? The same rules apply. Just because you can buy something without a prescription doesn't mean it's safe to mix with alcohol. Common pain relievers, cold medicines, and allergy medications can all have dangerous interactions with alcohol. Cold and flu medications often contain multiple active ingredients. Some include alcohol themselves. Adding more alcohol on top of that can lead to overdose of certain ingredients, severe drowsiness, and impaired motor function. People have gotten into car accidents because they didn't realize how impaired they were. The bottom line is this. If you're taking any medication, prescription or over-the-counter, the safest choice is to avoid alcohol entirely. I know that's not what people want to hear. Social drinking is a normal part of many people's lives, but your health and safety have to come first. If you absolutely must drink while on medication, talk to your healthcare provider first. Get specific guidance for your specific situation. Don't rely on internet forums or advice from friends. Everyone's body is different, and what was safe for someone else might be dangerous for you. Remember, medications are prescribed to help you. They're meant to improve your health and quality of life. But they can only do their job properly if you use them correctly. Mixing them with alcohol undermines their effectiveness at best, and puts your life at risk at worst. Your health is worth more than any drink. The temporary pleasure of alcohol isn't worth the permanent damage it could cause when mixed with your medications. Take your prescription seriously. Follow the instructions. And when in doubt, skip the alcohol. Your future self will thank you.